Your body already has medicine inside it. We just know how to use it. People come to us with a lot of different types of injuries, whether they be acute or chronic in nature. What we have to understand is that the symptomatology, the pain, the inflammation, the joint dysfunction, all of that is typically related to damaged tissue in the body. Now, we have access to a wide variety of tools, and those tools are designed specifically to heal damaged tissue. And that's really the basis for regenerative medicine, in much the same way that if I cut my hand, I know that my skin is going to heal, right? Because we have a healing ability that's present within our body, and it is present in abundance in certain tissues, but certain tissues in our body just don't have access. And this is why we develop the chronicity or the chronic pain associated with damage to that tissue. Now, when I say we have a wide variety of tools, it's because we do, and many of those tools are designed for various target tissues and used in combination. So sometimes we have to harvest stem cells from bone marrow. Sometimes we can take stem cells off the shelf. Many cases we take various blood components from the patient, and that is designed specifically based on how the patient presents and what their ultimate goals are, right? If we want long-term relief, then repairing tissue is absolutely essential. Having a wide variety of tools allows us to just be more successful. And there are multiple resources that we can utilize. Some of them are what we call autologous, where they come from the patient, and we can take stem cells from bone marrow. We can harvest stem cells from adipose tissue. We can take a variety of blood components that aid in the healing process as well, and we can use them to treat a wide variety of conditions. We also have the ability to take stem cells off the shelf in the form of either umbilical cord blood or Wharton's jelly or some other perinatal type tissue that allows us again to treat a wide variety of conditions in certain circumstances. Having one tool at your disposal just kind of doesn't allow you to be as effective, in my opinion. That's really the problem. And one of the things that's really interesting, having been in regenerative medicine for many, many years, I've seen many things kind of come and go, and there's some issues associated with certain products if that's your only tool in the bag. So, for example, Wharton's jelly and umbilical cord blood products are not bad. I mean, I think they're really useful in certain circumstances. But what the literature tells us in terms of actually regenerating certain structural tissues, there's a lot of evidence for bone marrow and PRP, and we have a ton of literature that allows us to make good decisions based on the evidence that's present. With Wharton's jelly and umbilical cord blood, it's not that they're not effective in helping to reduce pain. They just may not be as effective in promoting the long-term outcome that patients want. So previously, Wharton's jelly and umbilical cord blood products kind of came into the marketplace, and we call them injection mills. They're going to treat you no matter what. Whatever your condition is, however it presents, they're going to give you an injection. And the problem with that, what we saw with that, was essentially that a lot of patients didn't achieve the outcome that they wanted. And what happens is they say that regenerative medicine doesn't work. And that's really where the problem is, because there is no art and science in not evaluating a patient effectively and determining if there's a high likelihood for success first, and then using the tools and resources that would be most consistent with that particular condition in that particular patient based on the evidence and based on the clinical experience that you have. Right. And most recently here in Florida, they just passed a new law, actually just happened in July. And I think it's a great thing. I don't think it's a bad thing. And we do use these products. I want to be clear. But essentially, the law is that we're allowed to use experimental Wharton's jelly and umbilical cord blood products now, specifically for orthopedics and wound healing. Has to be done by an MD, obviously, and it has to be done in a proper clinical environment. I think that's a good thing, but I kind of get nervous that essentially we're going to enter a similar phase of the regenerative space where, it's going to become ubiquitous again, and lots of patients are going to consider that the only resource in regenerative medicine. And if they don't improve there, then it's going to kind of, turn people off and make people feel a little bit differently about what regenerative medicine actually is and what it can do in terms of changing lives and making people better. We'd be happy to tell you more and answer your questions.